131-foot wide asteroid may strike Earth, airburst in September, Space Agency says European Space Agency threat risk listed near-Earth earthbound object reveals real reason for worldwide lockdowns and the prepositioning of military assets, trauma surgeons, makeshift hospitals, and ventilators into Le Hub's Shepard Ambellas was right. Around September 1, 2020, plus or minus 7 days, the asteroid is expected to pass about 0.00050, 75,000 kilometers, 46,000 miles, from Earth too, but the asteroid could pass as far away as 0.110, 16 million kilometers, 10 million miles, 2, which could make the asteroid much fainter and more difficult to recover. There is no risk of a 2020 impact because the line of variation, LOV, does not pass through where Earth will be. JPL Horizons predicts that the asteroid may be hidden in the Sun's glare until hours before closest approach. NEODYS does not expect the asteroid to be more than 50 degrees from the Sun until August 21 or to become brighter than magnitude 24 until August 31, with closest approach occurring on September 5, 2020. Into Le Hub, the European Space Agency's Space Situational Awareness Risk List reveals that a 131-foot wide asteroid may strike Earth or airburst inside the atmosphere in September. ESA data shows that the compacted chunk of rock named 2018 SV13 is traveling at a speed of about 44,000 miles per hour and will be headed inbound on September 22 with a non-zero chance of impacting. I.e., the ESA thinks there is a possibility the asteroid may hit, although it is unknown if the object will miss Earth altogether, burn up in the Earth's atmosphere upon entry, airburst, or impact. One thing is for sure, planetary defense agencies in both Europe and the United States will be on high alert and will be ready to mitigate and/or deflect the object if need be. The ESA publicly estimates the probability of an airburst is a chance of 1 in 3.6 million, but if the near-Earth earthbound object were to airburst, it could pose a significant threat and cause significant damage to the affected area. The object has been catalogued in the ESA risk list for 624 days at the time this article was authored. There is a lot of evidence that suggests that the world's populace has been locked down to prepare or drill down for a future catastrophe in which world leaders know is coming. In fact, an article posted on space.com suggests just that. The piece titled "How the Coronavirus Pandemic Can Help Us Prepare for an Asteroid Impact" suggests that COVID may be all about readiness and preparation for what may be headed our way. David's theory dovetails with what Into Le Hub founder and editor-in-chief Shepard Ambellas has been talking about since early April, when the top-level sleuth discovered that the same institution that controls the COVID death map also controls the trajectory of near-Earth earthbound objects through NASA program publicly known as Project DART. Based on Ambellas' detailed investigation, he was able to accurately and publicly predict a massive planetary red alert nearly to the day when over 30 celestial objects converged on Earth over several days spans, prompting the activation of planetary defense systems. Trends analyst, investigative journalist, and Into Le Hub frontman and editor-in-chief Shepard Ambellas has been vindicated to the fullest extent possible after warning on many broadcasts which he appeared on last month, including his appearance on Coast to Coast AM with George Norrie, that the US government and other governments of the world have been pre-staging for some type of event or natural disaster using COVID-19, the invisible enemy, as a guise. Shockingly, the fearless journalist and talk radio personality hit the nail on the head when he not only predicted the day such an event would happen, but he literally called it on record several weeks in advance. To top it all off, the passage of the asteroid has been documented as one of the closest flybys ever recorded in history. Kazakhstan's health ministry has dismissed a Chinese embassy warning that the Central Asian nation had an outbreak of an unknown pneumonia that was deadlier than the new coronavirus, saying it was a misunderstanding of the official count. In a statement on its Facebook page on Friday, the ministry said the information given by the Chinese embassy was incorrect. The statement came a day after the Chinese embassy in Kazakhstan issued a warning to Chinese citizens about pneumonia of unknown cause in the country. In the first half of this year, 1,772 have died of pneumonia in Kazakhstan and 628 died in June alone, including Chinese citizens, the Chinese embassy said. That mortality rate of that disease is far higher than COVID-19, and Kazakhstan authorities are conducting a comparative study of the virus and there is no clear definition yet. While the Chinese embassy described the illness as an unknown pneumonia, Kazakhstan officials and media have only said it is pneumonia. The health ministry said the official tally included pneumonia caused by all kinds of pathogens, including bacteria and virus. All of the cases showed clinical symptoms of abnormal imaging regardless of their laboratory results. People queue in front of a coronavirus disease testing facility in Almaty, Kazakhstan, on Wednesday. Photo, Reuters. People queue in front of a coronavirus disease testing facility in Almaty, Kazakhstan, on Wednesday. Photo, Reuters. People queue in front of a coronavirus disease testing facility in Almaty, Kazakhstan, on Wednesday. Photo, Reuters. Kazakhstan's health ministry has dismissed a Chinese embassy warning that the Central Asian nation had an outbreak of an unknown pneumonia that was deadlier than the new coronavirus, saying it was a misunderstanding of the official count. In a statement on its Facebook page on Friday, the ministry said the information given by the Chinese embassy was incorrect. The statement came a day after the Chinese embassy in Kazakhstan issued a warning to Chinese citizens about pneumonia of unknown cause in the country. In the first half of this year, 1,772 have died of pneumonia in Kazakhstan and 628 died in June alone, including Chinese citizens, the Chinese embassy said. That mortality rate of that disease is far higher than COVID-19, and Kazakhstan authorities are conducting a comparative study of the virus and there is no clear definition yet. While the Chinese embassy described the illness as an unknown pneumonia, Kazakhstan officials and media have only said it is pneumonia. Worldwide reported coronavirus infections top 12 million. The health ministry said the official tally included pneumonia caused by all kinds of pathogens, including bacteria and virus. All of the cases showed clinical symptoms of abnormal imaging regardless of their laboratory results. It did not specify how many of the pneumonia cases which did not test positive in a swab test were probable cases of COVID-19, the disease caused by the coronavirus. It also did not say if any of the cases were caused by a new kind of pathogen. At a briefing on Thursday, Minister of Health Alexei Tsua spoke about pneumonia in the country as a whole: bacterial, fungal, viral origin, including viral pneumonia, unspecified etiology according to the ICD-10 classification, the ministry said, referring to the International Classification of Diseases, a global diagnostic tool. Calls to Chinese embassy in Kazakhstan were not answered. George Gaofu, director of Chinese Center for Disease Control and Prevention, was quoted by the China News Service as saying the Chinese authorities were still investigating and there was no further information. Chinese Foreign Ministry spokesman Zhao Jian said China was willing to work with Kazakhstan to combat COVID-19 and safeguard public health in the two countries. The WHO told the South China Morning Post that it was verifying with Kazakhstan about the latest development, but it was not aware of any emerging disease. The Ministry of Health of Kazakhstan published a statement on July 10 clarifying that cases presenting with pneumonia are diagnosed according to ICD-10. This suggests they do not classify as emerging unknown disease. We are in the process of verifying with the ministry the COVID-19 confirmed cases. There are a wide range of potential explanations for pneumonia, of which one is COVID-19, which we know is circulating in Kazakhstan, the WHO said. More than 10,000 laboratory-confirmed COVID-19 cases have been reported by the national authorities over the past 7 days. As case numbers are increasing, the country has recently reintroduced a range of physical and social distancing measures. We are currently in contact with the authorities in Kazakhstan to understand situation developments and provide support as needed. Kazakhstan news website Informburo quoted Izan S. Magambetova, chief sanitary doctor, as saying the death toll of pneumonia in general this year was 50% or higher than that at the same time last year. Tsua, the health minister, said earlier that pneumonia of all causes would be given the same treatment as for COVID-19. Kazakhstan has reported more than 50,000 confirmed cases of COVID-19. Tengri News, another Kazakhstan news website, reported that 28,000 people were hospitalized with pneumonia and tested negative for COVID-19. According to Russian news agency Sputnik News, Rafael Rosenson, an immunologist from Astana Medical University, said most of the cases should be COVID-19. It is impossible to say 100% or but 99.99% they were caused by the coronavirus. Because in the past there have never been community-acquired viral pneumonias in June, the doctor said. Have you heard about the unknown pneumonia deadlier than coronavirus sweeping Kazakhstan? Chinese embassy warns. Statement from embassy warns that death rate is much higher than coronavirus and says local authorities have yet to identify cause. Kazakh authorities have reimposed COVID-19 lockdown in some parts of the country amid a spike in pneumonia cases last month. The Chinese embassy in Kazakhstan has warned of a deadly unknown pneumonia after the former Soviet Republic reported a spike in pneumonia cases since June. The death rate of this disease is much higher than the novel coronavirus. The country's health departments are conducting comparative research into the pneumonia virus, but have yet to identify the virus, the embassy said in a warning to Chinese citizens in the country. While the Chinese embassy described the illness as an unknown pneumonia, Kazakhstani officials and media have only said it is pneumonia. It was not clear why the Chinese embassy had described the illness as unknown or what information it had about the pneumonia. The embassy's website, citing local media reports, said the provinces of Atirau and Aktobe and the city of Shymkent have reported significant spikes in pneumonia cases since the middle of June. Shymkent and the capital city of Atirau are 1,500 kilometers, 930 miles, apart, while the distance between the capital cities of Atirau and Aktobe is 330 kilometers, 205 miles. The Chinese embassy said that so far there have been nearly 500 pneumonia cases in the three places, with over 30 people in a critical condition. The country as a whole saw 1,772 pneumonia deaths in the first part of the year, 628 of which happened in June, including some Chinese nationals, the embassy continued. The Chinese embassy in Kazakhstan reminds Chinese nationals here to be aware of the situation and step up prevention to lower the infection risks, the embassy statement said. Salki Sakova, the healthcare department chief in the capital Nur-Sultan, told the news agency Kazakh, some 300 people diagnosed with pneumonia are being hospitalized every day. The agency also said there had been 1,700 pneumonia cases nationwide in June, more than 2 times the number in the same month last year. The Chinese embassy in Kazakhstan has warned of a deadly unknown pneumonia after the former Soviet Republic reported a spike in pneumonia cases since June. The death rate of this disease is much higher than the novel coronavirus. The country's health departments are conducting comparative research into the pneumonia virus, but have yet to identify the virus, the embassy said in a warning to Chinese citizens in the country. While the Chinese embassy described the illness as an unknown pneumonia, Kazakhstani officials and media have only said it is pneumonia. Worldwide reported coronavirus infections top 12 million. The country as a whole saw 1,772 pneumonia deaths in the first part of the year, 628 of which happened in June, including some Chinese nationals, the embassy continued. China and Kazakhstan try to smooth over deadly pneumonia. July 11, 2020. The Chinese embassy in Kazakhstan reminds Chinese nationals here to be aware of the situation and step up prevention to lower the infection risks, the embassy statement said. Salki Sakova, the healthcare department chief in the capital Nur-Sultan, told the news agency Kazakh, some 300 people diagnosed with pneumonia are being hospitalized every day. The agency also said there had been 1,700 pneumonia cases nationwide in June, more than 2 times the number in the same month last year. Kazakhstan announced a state of emergency on March 16 to tackle the spread of COVID-19. The lockdown was lifted on May 11, but restrictions and quarantine measures have been reimposed in some areas following the surge in pneumonia cases. Kazakhstan's President Kassym-Jomart Tokayev said in a televised address on Wednesday that the situation was still serious and it was too early to relax restrictions. He added the country was in fact facing the second coronavirus wave coupled with a huge uptick in pneumonia cases, according to the Russian news agency TASS. The Chinese embassy said on Tuesday that the number of COVID-19 cases in Kazakhstan had reached 49,683, including 264 deaths. Late last month, officials warned about the rise in pneumonia cases. Kisakova said that doctors were finding 600 people a day with pneumonia symptoms, compared with 80 a day before the start of the COVID-19 outbreak, the Singapore-based website CNA reported. Every day, 350 to 400 patients are hospitalized in the city with either COVID-19 or pneumonia, she said. Lines form at morgue as Kazakhstan dismisses Chinese fake news about deadly unknown pneumonia. Desperate relatives are waiting in line for hours for an overwhelmed Kazakh morgue to release the bodies of their loved ones, raising questions about the country's COVID-19 data. Official statistics show hundreds of deaths related to COVID-19 and more than 1,000 dead from pneumonia. But Chinese news reports about a form of pneumonia in Kazakhstan that is deadlier than the coronavirus have been dismissed by the Kazakh Health Ministry as fake news. Have you heard about this yet? The claim, a case of bubonic plague was reported in northern China. The COVID-19 pandemic has shown how diseases will thrive in whatever vector they're given. Recent reports from China's Inner Mongolia region further demonstrate how pockets of a disease can survive long after an outbreak has ended. The announcement was accompanied by a local alert to residents of the city warning off certain activities. The World Health Organization considers the threat of a bubonic plague outbreak minimal. The plague is a broad disease that spreads through a variety of animals, including rodents, flies and humans. The disease is caused by the Yersinia pestis bacteria, which can be found all over the world. The three forms of plague, bubonic, septicemic, and pneumonic, have all caused deadly outbreaks throughout history. Bubonic plague, the strain recently found in Inner Mongolia, was the disease responsible for the Black Death, the deadliest pandemic in human history. Bubonic plague, which is also the most common form, causes painful swelling of the lymph nodes along with fever, chills and coughing. It is typically spread through flea bites and contact with infected animals. If administered early, however, antibiotics can stymie the worst symptoms and prevent death. The various strains of plague have arisen in outbreaks throughout history. Plague cases are fairly common in China, though over the past decade reported outbreaks of the disease have fallen steadily. The Bioner case on July 5, Xinhua News reported a suspected case of plague in the Inner Mongolia region. Health authorities later said the case was a local farmer who was being treated in isolation and in stable condition. After the announcement, local authorities issued an alert in the city, urging residents to minimize person-to-person contact. The alert also banned hunting, eating or transporting animals that could carry plague, according to the South China Morning Post. Residents were also encouraged to report any suspected cases of plague, as well as any sick or dead marmots, animals known to spread the bacteria. At present, there is a risk of a human plague epidemic spreading in the city. The public should improve its self-protection awareness and ability, and report abnormal health conditions promptly, the local health authority said, according to China Daily. The announcement comes as China continues to fight the coronavirus pandemic, which began in Wuhan, in Hubei province. The World Health Organization stated it has been working with Chinese and Mongolian authorities to ward off a potential outbreak. We are looking at the case numbers in China. It's being well managed, WHO spokesperson Margaret Harris told a press briefing Tuesday. Bubonic plague has been with us and is always with us, for centuries, she said, adding, at the moment we are not considering it high risk. Yes, the bubonic plague has been found in China, but there are cases of it every year. While it might sound like another disastrous turn for 2020, it's actually not unusual for cases of bubonic plague to pop up from time to time. Kazakhstan Health Ministry rejects Chinese claim of unknown, deadlier pneumonia. More on the asteroid. The European Space Agency, ESA, has identified an asteroid that has a non-zero chance of colliding with Earth in September. According to the agency, the asteroid follows an Earth-intersecting natural orbit. The asteroid has been identified as 2018 SV13. It is currently included in the ESA's risk list, which is an online catalog of asteroids that have non-zero impact probabilities. This means that all asteroids featured in the list have a chance of hitting Earth in the future. As noted by the ESA, 2018 SV13 has been in the risk list for 617 days as of this writing. According to the agency, this asteroid has an estimated diameter of about 131 feet. The ESA predicted that 2018 SV13 has a chance of hitting Earth on September 22. The agency indicated that the asteroid might collide with the planet on this date with an impact velocity of almost 44,000 miles per hour. Although the asteroid might hit Earth at high speeds, there's a chance that it won't cause an impact event due to its size. Instead of hitting the ground and creating a crater, the asteroid will most likely burn up in the atmosphere and produce a powerful explosion in the sky. Unfortunately, asteroids' airbursts can still be very dangerous. Based on 2018 SV13's size, the energy from its mid-air explosion could be equivalent to multiple atomic bombs. Depending on the altitude of the airburst, 2018 SV13's mid-air explosion could still cause a lot of damage on the ground. 2018 SV13's chances of hitting Earth depends on various factors in space, such as the gravitational pull of large cosmic objects. These objects, such as planets and moons, can nudge the asteroid into a collision course with Earth. Fortunately, the ESA noted that 2018 SV13 only has a small chance of hitting Earth in September. According to the agency, the asteroid's chances of colliding with the planet are 1 out of 3.6 million. If 2018 SV13 misses the planet on its upcoming approach, its next near-Earth flyby will occur on August 14, 2022. During this time, the asteroid will fly past Earth from a distance of 0.13649 astronomical units or 13 million miles.